Hey everybody, this is my project overview PowerPoint here. So the topic of my project is the implementation and education of doctors, RTs, nurses, nurse practitioners, and PAs on an adult bronchodilator therapy protocol. So pretty much the protocol is a scoring system that when new patients come in, uh, the therapy just ordered per respiratory protocol, and and this utilizes a scoring system that assigns points for breath sound, shortness of breath, home usage for bronchodilators, and and cough and peak flow. And based on the amount of points that the patient scores, they could be anywhere from just PRN treatments to QID to Q4 hours or Q2 hours. And then also part of the protocol is all COPD and asthma exacerbation patients are automatically Q4 for the first 24 hours. And then they can be reassessed, which is done daily. And then if they can be scored down and their treatment frequency scored down, they will. But the patient obviously also will never receive treatments less than what they normally take at home. And then when you score down, it can only be, just one step. So you can't go from Q4 to PRN. It's Q4 to QID. So the objectives of the education program here is to remember the bronchodilator therapy protocol, understand the importance of following it, apply the protocol to the inpatient setting, analyze the effectiveness of the protocol, evaluate areas for improvement, and create ways that the protocol can be improved. So instructional materials to be used. Not trying to be death by PowerPoint when teaching. Really, it's just copy of the bronchodilator therapy protocol policy and pocket reference cards, trying to do this on an equal setting. So the idea is to discuss the protocol, how it works, and then just getting people out onto the floors and actually using the protocol with patients and scoring patients to see how it works, etc. So they get an idea of how it works, and then so everybody knows how to do it, how it works, how to use it, etc. So the components of the evaluation. So as I mentioned before, the audience is RTs, doctors, nurses, PAs, and NPs. The purpose of it is to get all providers on board with the protocol, ensure that the providers that are ordering therapy are using the protocol when ordering and not ordering out of protocol, and then also ensuring that direct care staff are using the protocol properly and actually scoring patients and seeing patients as they're supposed to be seen, and then the determined readmission rates of COPD patients are reduced. The scope, the initial introduction period of the protocol, and then obviously branching out after the protocol is implemented and training existing staff, and then obviously training new hires, and then reevaluating the protocol for improvements. So resources, having an education room for just initial teaching, workstation on wheels for being out on the floor and teaching the people the protocol and using it, the Epic electronic medical record, and then just materials for handouts. So the evaluation model. So two models really can be used. So process evaluation, which shows how well the program is working, and then the formative, which shows if the program itself is needed, accepted and understood by the audience that you're trying to reach, and it also allows for changes to be made before full implementation. Plan to design and implement evaluation. So for process evaluation, the Epic electronic medical record, you can run reports on who is putting in orders. So if they're ordering per protocol or not, you can run reports to see who's actually scoring patients properly. So, in those areas that you can see if people are ordering it and using it properly. So if corrective action needs to be taken, obviously it can. And then also, you can run reports from as far as readmission rates goes if the protocol is helping or actually worsening readmission rates. And then for the formative evaluation, really could be, surveys and then just direct discussion. You could gauge feedback from the learners on the protocol, if there's any areas of improvement, any recommendations for changes, etc. And just my reference here, and that's it. I hope you enjoyed my short presentation. I went a little bit over, but thanks.